In my experience, caregivers are the most creative, resourceful, and resilient people on the planet. And I'm sure many of you have discovered that. The two women I have the pleasure of introducing certainly exemplify those qualities. Lois Hirsch, they're both to my right, to my far right, cares for her husband, Evan, who was diagnosed in 2002. A regular support group attendee, Lois brought to our attention the need for a group for spouses who are facing increased challenges as their loved ones progress to the middle and later stages of their dementia conditions. Lois stepped forward to lead this group, which began in January of 2008. Despite another historic event occurring that very same day, President Obama's first inauguration, that was some really killer scheduling, five or six showed up to receive and exchange support. The group has been growing ever since and is now one of our most well-attended meetings. Doris Lynch, to my near right, cared for her husband Harold for over 8 years, following his diagnosis of Alzheimer's disease. Harold passed away in 2008. Doris wasted no time in stepping forward with her request to give back after receiving help from us and other agencies providing support to families. Doris responded to a request for a brief talk at a local Rotary meeting, which was met with rave reviews. She's since become a hit on the service club circuit. So if you are a member of a local civic organization, she would be happy to give a talk to your group. Lois and Doris have been together on numerous caregiver panels at the VA and UCSF Memory and Aging Center, chronicling their similar yet unique caregiving journeys. We are very glad to have them here today to share their wisdom and experiences with us. After their presentation, we will have 10 minutes for questions. Please join me in welcoming Lois Hirsch and Doris.
Thank you, Deanna. And thank you to the Alzheimer's Association for sponsoring this education. It was very helpful to me when I attended, and I'm sure it is for all of you. Lois and I are really happy to be able to share and be able to inform a little bit and inspire a little bit. And as we talk about our journey with our husbands, I'm sure that you out there will identify as we go along someplace. It's been said that if you meet an Alzheimer patient, you've only met one. Every caregiver story is similar yet unique. My husband Harold died 4 years ago. He was 77. Harold was only 69 when he was officially diagnosed with Alzheimer's in 2001. We were nearing retirement at that time. We had hoped to travel, but this was not the road that we had planned to take. As I look back, knowing what I know now, we were seeing signs of Alzheimer's for several years before Harold was diagnosed. Our business partner was frustrated by his forgetfulness. I had already retired from my job as a medical bookkeeper when I was keeping books for our light manufacturing company. As the machinery became more sophisticated with computerization, Harold was not able to keep up. He was not able to learn it. I think he realized that he was not carrying I think he realized that he was not carrying his load, and so he was ready to sell to our partner and retire. When we were home together 24/7, I knew that something was wrong. Harold had no initiative. He wasn't interested in anything. He mostly dozed the day away in front of the the television. Although he was still driving, he forgot where he was going. He forgot where I said we were going. He didn't know how to get to familiar places. He asked me the same questions again and again, forgetting that I had already given him the answers. It's important to get an official diagnosis early. There are medications available which do help with the symptoms. These medications, as you know, do not cure, but they help provide a quality of life for a while. When I called our family doctor, he ordered the blood tests, x-rays, MRI, cognitive testing. After everything else was ruled out, the diagnosis was probably Alzheimer's. Probable because they couldn't tell for sure until after an autopsy. Harold started on the available medication and it worked for him. He was interested in life again. Our experience of getting a diagnosis was not lengthy and frustrating, but sometimes it can be.
I want to tell everybody who's here today, I hope you don't fall asleep after that wonderful lunch. I'm trying to keep you awake. As Doris said, diagnosis can be very, very traumatic and different for different people. Evan was first observed in 1995. That's almost 20 years ago. He had confusion. I asked for testing from the primary physician as he was forgetting things and frustrated, but he was very aware. We were told it was stress and anxiety because in 1995 he had just retired from his job, and in that same week his mother was diagnosed with terminal cancer. And we were told that it probably was just anxiety. However, he could not process the paychecks for his mother's caregivers. Fast forward 5 years to the year 2000. The family doctor and Evan went to lunch because they were very good friends. The next day I received a phone call from his doctor that he should be tested. Results from 2 separate tests given by a private neuropsych and one at UCSF showed a diagnosis of mild cognitive impairment with an 80% chance of Alzheimer's. He started on Aricept and Memantine, now known as Namenda. At this time, as Doris said, I would like to stress that early and precise diagnosis is extremely important, as well as communicating with your doctors until you get one. And the earlier you get a diagnosis, the better. During these years, I noticed he wanted to be active. We volunteered at guide dogs. Evan volunteered at hospice. He continued to go to movies, plays, and other recreational activities. But recall of things like where he parked the car or learning computer skills were noted. The forgetting was getting worse. Short-term memory and temper became shorter and shorter. Did you talk about driving already? No, go ahead.
No, life was not over because of Harold's diagnosis. We were able to do a few car trips with me driving. We flew to the East Coast and Central America where we had friends. But then airports became a challenge. I never lost Harold, but I was very concerned that I might because I have a friend who did.
Yes. Doris mentioned driving first. Evan gave me a very hard time about giving up driving. I mean, it was extremely painful. To take the burden off of me, I was able to get the VA doctors and nurses to notify the DMV. Evan studied online questions for the written test, but he had to take the driving test. He went without me, and when he was asked for proof of insurance, he couldn't find it. It was in the glove compartment the whole time. Needless to say, his license was taken away, but I had a very angry husband for a long, long time. Traveling was another experience. Evan would pack and unpack and repack bags each night. I didn't realize until later it was because he didn't remember what he had brought. In the Portland airport, we were in an elevator. Evan was behind me. When I got off and turned around, there was no Evan. He had stayed on. I waited for the elevator to come back, but no Evan and no suitcase. I took the elevator to the ground floor, and sitting in the middle of the corridor was his suitcase. This was right after 9/11, and I was amazed it hadn't been picked up by security. After contacting security and showing them Evan's picture, which I recommend that every caregiver carry of their loved one, Evan returned on his own. A big sigh of relief. During this time, I learned to make some accommodations also. When traveling, we went on guided trips, like Elder Hofstra, which is now Rhodes Scholar. I didn't have to worry about hotel reservations, driving, sightseeing, or meals. However, I did have to watch Evan very closely, as he would wander or go into somebody else's hotel room. Sometimes I also had to make changes at home. On one occasion, I was short of temper with Evan, so I walked into another room to cool off, and I became aware the house had become awfully quiet. Realizing he wasn't in the house, I called the neighbors who hadn't seen him and finally called the sheriff. By the time the deputies got to my door, they informed me the highway patrol had picked Evan up, walking up, we live in Marin County, up Waldo Grade towards the bridge, and they had taken him to Marin General Psychiatric Unit. The deputy called there for me, and when I told the person in charge that Evan had Alzheimer's, I was told, "We don't want him, come and get him right away." After that, I put bells on all the doors that led to the outside so I could hear when he went out.
We do learn as we go along. At the continued urging of our doctor, I contacted the Alzheimer's Association in Marin County, and we joined an early stage support group. We made some wonderful friends there. That's where we met Lois and Evan. Harold met in a group with other patients, and I met with other caregivers. In the group, we learned about all the resources that were available. And when we needed them, I took advantage of Daycare for Harold and respite for me. I was determined that I was going to stay healthy.
I felt I was immortal and could do everything. Not true. My health deteriorated. I developed high blood pressure, high cholesterol, and lots of stress. I was feeding off of Evan's moods. If he wasn't a good one, so was I, but if he wasn't a bad one, so was I. I was very quick to anger. My patience was gone. I was on a roller coaster, and I had trouble asking for help. I started to investigate respite and long-term care.
Okay. At the Alzheimer's Association, we also learned about the memory clinic at the VA. And we met Cindy Barton there. If you've any of you have met her, she becomes an instant friend. We learned from her about the research programs at UCSF and that Harold could be a participant. He wanted to take part in research that would help to find a cure for future generations. We have 4 grandsons. He was part of a study at UCSF, and he arranged to donate brain tissue at death. And Evan is also in a research program there. We went with others to Sacramento several times for Alzheimer's Advocacy Day to lobby our legislators for money for research and also for caregiver support programs. We were on a serious mission, but these were fun times. Harold had always been social, and for a long time he maintained the ability to function in a social setting. Old friends couldn't see any difference in Harold, and they said so, and that was not helpful to me. It made me feel that I was complaining about nothing. But unless they lived with us, how could they know? They weren't there to sense the fear or the frustration, to see the subtle changes and observe his abilities gradually declining.
At that time, there was a role reversal. While Evan was still able, we took care of financial, legal, health, and even death wishes. It is extremely important, if at all possible, to take care of these items while the loved one is still capable of stating his or her wishes. And it certainly makes it easier later on and diminishes guilt feelings. 3 years after Evan's diagnosis, I had become a full-time caregiver as Evan's long and short-term memory were declining. I had to give up my job. He was relying on me for everything. Think of a 5-year-old deteriorating almost to a newborn. I called myself Jill of all trades. I needed help and support. Evan received home care 4 hours a week from the VA, and when that wasn't enough, had private care a couple of times a week, and finally adult daycare. We no longer saw our friends as often. Some of our longtime friends and his golf buddies dropped us from their lives. Evan did like music, and we attended symphony and all the free concerts that we could in the summer.
In 2006, we moved from San Rafael to Petaluma to be near our daughter and her family. We bought a house just up the street from them in a familiar neighborhood. Preparing for that move was difficult. Harold wanted to help, but he usually caused more work for me. He kept putting things back that I had already sorted and already packed. I was not always patient. It was a relief to get moved and to get settled in. Harold helped on an ongoing basis, always putting things away. Of course, he didn't remember where he had put them, but I guess it made sense to him. I had duplicate items of everything that we would need in the morning, like a wallet, a golf hat that he wanted to wear every day. It was easier to have duplicates than it was to look for them when I didn't have time. When something was missing, the first place I looked was his sock drawer. I might find tools from the garage in there or things from the kitchen. They were usually wrapped up and put away, never in plain sight. Maybe in a pillowcase or in a shoe in his closet. Most things turned up eventually in places that made no sense to me, but I guess it did to him. Harold began attending adult daycare 4 hours a day. He enjoyed the activities, the crafts, the social interaction, the dancing and the music, and I enjoyed having time without him so that I could get things done that I needed to do, or go to lunch with a friend, or get my nails done, or just veg.
I too needed to have an outlet. Evan started adult daycare by attending the excursions offered by the Senior Access Program in San Rafael. These outings were with a small group of people like him, and he bonded so that when he could no longer go on the trips, he transitioned fairly easy into the daycare program. You might ask, how do you get your loved one to go to a daycare program? Well, we started by being a volunteer. We had a wonderful, beautiful lab that was had been a guide dog, and we used to take our guide dog to Pika to the Senior Access Program and as a volunteer. And then he transitioned by going as a volunteer to help sweep and clean up places. No, he didn't realize he was a client. He thought he was helping out, but it got him there. Okay.
Evenings were the hardest. Harold was confused a lot. He was unable to carry on a conversation. He saw people who weren't there, like his mom. He might say, "Where'd Mom go?" I would ask, "Was she here?" He'd say, "Yeah," and he'd point to the couch beside me. Or he would ask if I had talked to his dad lately. He reminded me to feed the dog. At first I thought I should be honest and help him remember that we didn't have a dog, and that his mother and dad had been dead for years. But he appeared surprised and hurt as a result of these conversations, and with an expression of grief, because he truly didn't know that they were gone. I learned that it was kinder to just agree with him and try to change the subject. Like, your mom probably went to bed already. We'll see her in the morning. Or, we'll call your dad in the morning. Don't you think it's too late now? And he was satisfied with those explanations. Lois said, we call these fiblets. It's okay if you have to quit telling the truth.
It's necessary to be in the moment of your loved one. Rather than argue, agree. And if it's not the complete truth, then call them fiblets.
Yeah, it's okay. We often had the same conversations again the next evening. But I learned that I could not bring Harold into my reality. I could not reason with him. It worked better if I could just enter into his reality. Can't always do it, but try. Seeing things or people who aren't really there is a symptom of more advanced Alzheimer's disease. Occasionally he asked me where Doris was. That's me. I think that in his mind, Doris was the young brunette that he had married, not this white-haired old lady. As time passed, Harold needed more help finding his way around the house, getting out of bed or an easy chair, showering, dressing. He had difficulty finding words. If I left the bedroom to fix breakfast before he was completely dressed, he might put his pajamas back on over his clothes. More than once he came out with a puzzled look on his face. Why couldn't he get his jeans on? They were so short, and he couldn't button them. You're right, they were my jeans. Little things that are comical now, but at the time they were a big deal, because they indicated to me that the disease was progressing, and that I was losing him and he was losing himself. Often, in spite of adult diapers, the bed would need to be changed in the morning and sometimes during the night. It took me a while to realize that he could not get out of bed by himself. I eventually learned to accept the inevitable changes instead of fighting against them. Even though the chores of everyday life were getting more difficult, he remained pleasant and quick to laugh, unless I mishandled him, which I did more frequently. I was losing my ability and my desire to cope. Harold was frustrated when he couldn't figure out what I needed him to do, and sometimes he made a fist. I sensed that our relationship was deteriorating, and that was not okay with me. I didn't want to do this anymore. I began to envision him in a facility, and me the nice lady who came to visit.
So you start to look for placement. I started looking at respite and long-term care facilities as early as 4 to 5 years before need. I wanted to be informed so if an emergency arose, I would have some idea of where I would like Evan to go. We tried respite in 2 places, and I had a long list of long-term care places where I thought it would fit his needs.
When I started to look, I found 2 places that I liked. But it took months to get up the courage to do what I knew I had to do. My daughter and her husband were supportive, but I had to make the decision. I was fighting guilt and a sense of failure and feeling disloyal. It was very hard to come to the place of letting go, knowing that I'd done the best I could for as long as I could, and then to let someone else do it. It was at this time that I was attending one of these conferences here, and there was a speaker, Ann Davidson, and she had written a book, and I hope that if you haven't read it, you will. I'm sure it's over here. A Curious Kind of Widow. And she was describing exactly what I was going through, and it was really, really helpful for me. That July 4th weekend, it was in 2008, it was a turning point for me. I could not get Harold out of bed. He was having a bad day, he was unable to cooperate, and I didn't have the physical strength. And no one in the family was around that day, so he stayed in bed all day. I alternated between yelling at him in frustration and crying in defeat and disappointment. It was the worst day.
So when is the appropriate time for placement? When I was sick one weekend, I was not able to care for Evan or our dog. I had no one to help me, and I realized it was time to place him. I also realized it's not when your loved one may need it, it is when the caregiver needs it that you need to go look at placement. If you can afford it, I realize it's very expensive.
That September, after that 4th of July weekend, we moved Harold to an Alzheimer's facility. Sunrise, in case they're here. He liked it there. He never asked to go home, and he didn't seem to matter to him if I was there or not. He liked his caregivers, and they liked him. Our timing in moving Harold was right on. He was now rapidly declining physically as well as cognitively. Soon he was not able to walk or feed himself. He could not read or take part in any of the activities or conversation. But he was pleasant, and he cooperated as best he could. Eventually, he could not sit up in his wheelchair, and he was in bed or his lounge chair most of the time. Then the day came that he could not swallow. I knew what to do. He had made it very clear years earlier that he did not want to be kept alive by artificial means, including a feeding tube. We called hospice in to assist with his care. He passed away peacefully 8 days later, March 27th, 2009. 8 years after his diagnosis, and he had lived in Sunrise 7 months. I did manage to stay healthy, and there is life after Alzheimer's.
Even though I had researched placement of many places, I was told to select a place close to home. So I chose one about 7 miles from our house that had a secure facility, as Evan was a wanderer and a walker and needed to be in a secure place. He was extremely combative and angry from the very first. He was so angry that the caregivers did not like to get in the shower with him. And at the advice of his VA doctor, I went twice a week, putting on a bathing suit, and got into the shower with him. It did help some. After 15 months of my being unhappy with the facility and his continued antagonism, I returned to several places I had looked at in the previous quest for placement. I finally settled on one and made the transition. And from the moment he entered, he was docile and almost sweet. The people and the caregivers at the new facility did not believe me when I told what his past actions had been. It was then I realized he was so unhappy at the first place, the only way he was able to tell me was to act out. So please be aware that changes in placements do happen, lots of times for the best. Evan is still alive today, and I like to think that he is happy and at least calm. I'd like to talk about 2 other things that have nothing to do with that right now. One of them is trips to the hospital. Be aware of your loved one going to an emergency room. Not all personnel there are trained to work with dementia patients. Evan was taken twice at the first facility. He was so angry that he actually pulled the neck brace off his neck that the paramedics had put on him. The hospital personnel in the second occasion had put him in a room with a 6-year-old who had a broken thumb. Evan was cursing up and down as only a military man could do. And I felt that for that child and that family. Neither of his visits were life-threatening, and he returned to the facility within 4 hours each time. After the second episode, I signed what they call a PULSE, the physician's order for life-sustaining treatment. There's a box that can be checked that says, do not transfer to hospital for medical interventions. I've been made aware by the staff and by the state that I made it aware to the staff at the current location that I be called immediately because the paramedics do have to be called. They are to call me and I will make a decision on the phone with them if he is to be transferred. I'd also like you to familiarize yourself with resources. Doris talked about some. I try to keep informed. There's the Alzheimer's Association, there's the VA, there's the Family Caregiver Alliance, there's Daycare, there's books. Today you've got the computers such as YouTube, Google, seminars like this one. There's some books to look at, and I think they're in the back, but I'm not positive. I recommend if you read only one, read Learning to Speak Alzheimer's. But there are also others about personal experiences that may relate to you. 4 of them I would like to quickly mention. One is written, thank you, I'm almost there. Actually, I will be sure. One of them is written by Ann Davidson, the wife of a caregiver that took care of her husband. One is written by a husband who took care of his wife. One is written by a daughter who is taking care of her father. And one is written by a woman who took the role of a person who is experiencing Alzheimer's. In closing, I would like to state the caregiver has to set the tone. Be prepared, have no expectations. Ask for help sooner rather than later. Take care of yourself. And at last but not least, live day by day, hour by hour, and minute by minute. Thank you.
I told you they were resilient and creative and resourceful. So I'm sure you want to have more of their wonderful wisdom. Questions for Doris and Lois?
You mentioned 4 books. 4 books. Could you tell us the name of the 4 books?
Certainly. Let me get them out here. Ann Davidson wrote A Curious Kind of Widow. It's the viewpoint of the wife. Mary Ellen Geist wrote Measures of the Heart. It's a father's Alzheimer's and a daughter's return. It's a viewpoint from the daughter. Lisa Genova wrote a book called Still Alice, which is a fiction from a person with an Alzheimer's point of view. Barry Peterson wrote Jan's Story, Love Lost to the Long Goodbye of Alzheimer's. And unfortunately, he just lost his wife. And then the last book that I was talking about is Joanne Kostick-Koenig's Learn to Speak Alzheimer's, which is sort of a Bible more than a fictional story or a story about a person's experiences. Does that answer your question?
Thank you. Hi.
Did either of you or both of you utilize support groups, and were they helpful to you at all?
Oh, yes. At the Alzheimer's Association is where we met. We were in the same support group, and Lois now is leading a support group in Maria County. But I was a person that didn't really think that support groups were all that important because I'd never needed one. And I used to see the long list and the Marin IJ of all the, I mean, you could get support for everything or anything. And I just thought, you know, these people just need to get a life. Who goes to these anyway? And then all of a sudden, you know, at the urging of the Carrolls doctor, I finally contacted the Alzheimer's Association, and it was a lifeline for me. And I've heard many, many people say that. It's the first thing, if I meet somebody, it's the first thing I say to them is, are you in a support group? Have you contacted the Alzheimer's Association? Yeah, for sure.
When are you writing your book?
Everyone here?
When are you writing your book? That I said.
Two of us.
Yeah, you write a book.
We might, you never know. Yeah.
It's not a question, it's a comment based on a couple of what the lady on the left said. Anybody can report a person driving that they don't feel is safe. On the California DMV website, there's a form called Request for Driver Reexamination. And you can even check that you want to be anonymous. So if you want to report a neighbor, friend, husband, a mother, you can go ahead and do that. And but you can mail it to the DMV in San Francisco, and they do investigate what's going on. So I just wanted to bring that.
Thank you. Except that my husband would have known I sent it in.
Blame it on the doctor. That's what we say.
Hi. My parents have a really, really strong support system, and within that support system, they have a couple. She has pretty advanced dementia, and he is doing all the caregiving. And I guess my question is for you, do you have any advice for the circle of friends to encourage him to get some help and support? Because he's not there yet, and the friends are feeling like they don't know what to do to help him.
Well, there is, the Alzheimer's can answer this for you, but there is a men's support group, men only, for people like that. And it may be if you could get one of their friends to make the initial contact and go in with him to the group, it might be a way of getting it started.
And I want to mention too that the support group that Doris and Lois met each other was an early stage support group, and it's not just for the caregiver, it's for the person with the diagnosis. So they would come together and meet in separate groups. One room's talking about each other, you know, but at the same time it is support for the person with the diagnosis. And we have a group in our Santa Rosa office and one in our San Rafael office, waiting list right now, but you know, it's just not only the caregiver, we want to offer that support for the person that has just received this diagnosis.
Yeah. I would like to add to that too, that one of the things, it's not just a support, it is a support group, but one of the things that you do is you start to make lifelong friends, and you start to be very, very comfortable with other people who are in your same situation. And you don't have to worry about the friends outside who are going to drop you, or the friends outside who don't know what to say to you, because the support group people support each other. That's exactly what it is. And as I say, Doris and I met back in 2000 or 2001, and we used to go, even when we weren't having meetings, we'd take the groups out on field trips, and we would do lots of fun things. So it is a very worthwhile thing to look into.
And if we get a few more pairs of folks, we can start new groups.
Okay, David, you're trying to get me to get my exercise, aren't you?
So this question is for Lois. Lois, what do you believe was the dramatic difference between the first community that you brought your husband to and the second community that actually seemed to work for you?
The first community didn't have any place for him to really walk around, and he was a walker, and he needed to walk. There were some other issues too that I just assume not go into right now, but that was the main reason. And as I think one of the things that evident, because he couldn't get out his walking and his aggression through walking, he took it out on caregivers or he took it out on other people and showed a lot of anger. But there were differences in between the two facilities, quite a bit of difference between the two facilities too.
Thank you very much.
You're welcome.
Final question, final words of wisdom from, yes, you may.
As a nurse case manager, I just want to follow up on something you said about the nurse, about going to the emergency room. It's about going to the emergency room. Kaiser, this is such a problem that the emergency rooms now are paying attention to this. And Kaiser, if there's a problem, has a social worker who used to have Deanna's job. Juliana's son, who comes down and helps in the emergency room. But in general, they often call myself or a few other people. But it's very dicey in the emergency room. If you're taking somebody to the emergency room, generally it's because they have an emergency problem. Okay, don't take them if it's not an emergency, because they're going to look at you and say, why did you come here? Because it's so upsetting for the person that's there. It's upset. The whole thing can be really a problem. It's really important that, and certainly if they break a leg or anything like this, but think twice about going to the emergency room. There's urgent care that you could go to. Also, the Holst forms, which is a whole other subject. That's the pink form you can get from your doctors now, and there's Holst evaluations. They've talked about it a couple times today. Are very important for everybody in this room to fill out if they're involved with someone who has a dementing illness. Because when you go to the emergency room, they want to know what the wishes are. If your person does not have a Holst and doesn't have a pre-hospitalization DNR, they will resuscitate them if no one's there to give information. And that's really a problem because you have to decide whether you really want to do that or not.
Thank you, Darlene. And we have one more question.
I just wanted to say in response to that there's the in-between phase, and I wonder if you could speak to how you experienced it for people who, after their diagnosis but before being placed, are difficult to get into primary care. And so you become lost to your primary care for either routine or urgent visits when it's just impossible to put that person in a car to get them to understand why it's needed to follow up, and there's no access to visiting physicians. Have you experienced that, and do you have a solution?
I have not experienced that. I am a primary care person, but my suggestion would be if you can't get them into a car, you call a neighbor or a friend or somebody else who will help you get them into a car and go with you to wherever you need to go. And they said urgent care will take them, or they said urgent care would take them. I don't know if they have urgent care in Sonoma County, but in Marin County we have an urgent care facility. So I would suggest something like that, especially if they're difficult following directions and getting in and out of cars. Take a friend with you or take somebody else with you to help you, especially if you have to park the car and you've got to get them out and inside. You have another question?
Well, I think my comment would be more that there's a gap for people who are low income or unable to access urgent cares and just fall between the cracks. So I think that there's a solution needed at a primary care level of visiting professionals that can be accessed without the restrictions that we imply currently.
You know, we've been, Lois and I have been really encouraged lately because we have been invited to come and talk to professional people. This one group we talked to at UCSF, there were dentists and physical therapists and emergency room people. There are people that are already in their jobs and they're reaching out. They want more information. They want to hear from the caregiver's point of view. And I just think, yeah, it's really encouraging. And I think that the more we talk to people, and this, you know, because there is a stigma. I mean, we just have to admit it. There is a stigma. And the more we can talk to people and the more we are open with people, I think it's a long way off, but maybe not so far as we think, because there's a lot more interest out there. And it's been very encouraging to us to have that opportunity to speak to these people that are, you know, they want to do better at their jobs. So.
And I think we all here today feel privileged to have both of you here sharing your stories. So thank